So Professor Anita already said everything, so I can stop now. No, but I want to explain. I took this map to show you where our region, where I'm really located, I'm working to. So it's almost similar to Lithuania, this part, and we have many, many transplant centers around. So we can reach Mainz in 15 minutes, Wiesbaden in 20 minutes, Frankfurt in 20 minutes, Heidelberg in about a quarter of hour, 3/4 of an hour. So it's really something. I think it's worth to have some of the transplant center here in Kaunas as well. So Dietke already mentioned almost everything, and I have to say I had the problem that my son was diagnosed with acute leukemia in December 90, and with a prognosis to survive at least 4 weeks. And I started to look for information that I could understand, because I'm not a scientific person and I'm not an academic. I'm a mother, and I wanted to know what's going on. So after 3 months, my son was in a better condition, and they asked me that we should look for a bone marrow donor. But in Germany, by that time, we only had 2,500 registered, and that was nothing. So we started to collect, and I was traveling around Germany, and I collect 65,000. So now I think the German DKMS has a lot of potential donors, so that we are able to find, at least in 3 months, a donor. So, and by that time, many patients came up to me and asked me, Anita, are you only looking and supporting patients with leukemia, or also with the other hematologic diseases? So I started this, and I think it's not over now. So everything is life-threatening, and I think it's important that patients have the right support. Do you know all what advocacy means? In Germany, it's not a really common term, so most of the people think you have to be a lawyer or something. So I think we can influence a lot of people who have something to say in the world of medications, but also in politics and everything else. And what I always try to explain, it's the opposite to put the head in the sand, or what you call with the ostrich. I think it's the animal it's called. So, like I said, you have to be independent, and you always have to fight for it. You have to be very, very strong sometimes, because not every door will be open immediately. So you have to knock 2 or 3 times, and even when the door closed, you have to knock again, and you will reach out some success then for the patients. So you don't have to be a lawyer, a doctor, or a politician, but I think everyone who is caring for patients as well are able to do so. And I made some link on the bottom. So in that internet resource, you will find how to be an expert patient, how to become a patient advocate in 13 languages. We started this to do it for myeloma patients, but it's still valuable for everybody. Like that, we never would have achieved any, so I think you can imagine that you have to be very aware what's going on in the world. Patients also want that they are respected when they have some symptoms what they can't cope with, because the diagnosis is very scary and overwhelming. So therefore, it's very important to listen, and to listen really what the patients are telling you. It's not only that they say, "Oh, I feel good," and in the brain they have concerns, and they are very afraid that something will not going well. So most of them, and I don't know how you do, are searching and asking Dr. Google. So, and as you know, it's more confusing than it really helps to find the right information. And therefore, we guide the patients and the relatives, and that they really find the right way. Because it's important to understand everything what the doctors are telling. And I know when you get the diagnosis as a patient, you will be so overwhelmed by the moment that you think you will fall in a deep, deep hole and don't listen anymore really what the doctor will say. So you need to have really the possibility to come a second time to make some notes that you can ask the questions what are important for you. And there are lots of different treatment options now, and you will hear a lot of this from our professionals, so I won't explain anything, but the patients have to know what's going on. And therefore, we not only explain something by meetings or patient and family days, we also producing booklets so that patients can read what they expect and how they should cope to be better prepared for this. And here I have to say something to my former speaker. We would love to be, as a patient advocate, also involved at JC and EBMT, because the Patient and Family Day changed a lot now. We would love to have this presentation you just made, and not only, exchanging experience from patient to patient. So that is something we need to be more political also in the EBMT. And I just wrote an email to the next president of the Congress in Lisbon. So I think there are many questions and a huge need of information. And I don't know how you would feel. I don't know how many patients are here. Can you raise the hand? One. Okay. So, but in our case, in Germany, they don't like the term education. They want to be informed, and you have to have really good information. And so we try to do our best. Patient and relatives must cherish hopes, and I don't want to go through all these because I want to save some time. But through a patient support group, by own experience of other patient and relatives, they can really cherish this hope because they have some examples of how they came through this treatment. And they have mindful and emphatic listening. So qualified information about disease, treatment options, ongoing trials, coping with side effects, coping with social problems, professional psychosocial social support. And we do this by monthly meeting with patient and family seminars and brochures. And like Dietger said, we also had a long time ago a patient and family congress in his city and with university, and I think they repeated last year again. So we had a really good experience by that. Patients' expectations are really the best possible treatment, and if possible, even surviving, and not only surviving because of the survival, but with best quality of life, and if possible, to be cured. less side effects, best quality of life, supportive care, long-term rehabilitation, and that I'm fighting right now for, because when our patients are transplanted or having their chemotherapy treatments over years, they need a long-term monitoring and a long-term possibility to have rehabilitation. And if needed, palliative care, and they have to be explained that palliative care doesn't mean exactly also hospice, because palliative care means that one of our patients already has palliative care for more than 20 years. But before that, it needs to have an accurate diagnosis, and I know that many of the patients are now diagnosed with a molecular diagnosis. So I'm a little nervous. I think you can hear it because I'm not fluent. So there are several possibilities to understand the treatment, and they have to have the chance. What outcome shall be achieved, decide together with their physicians which treatment should be chosen, and ask for a second opinion. Many doctors are feeling offended when a patient said, "Doctor, I want to see another doctor if that's the same meaning of my treatment or of my disease." And the most important thing is that physicians have time to explain the journey and to build up a trustful relationship with the patient and with the relative. Most of the patients don't have the chance to understand what the bone marrow is. And we made this booklet together with our American friends because it shows very nice, how the bone marrow looks like, and it's explained in different languages also what the bone marrow does and has to do in the disease. So to understand all this makes the patients much more compliant and adherence to stay with the treatment. And I brought two examples. We have a patient who has a transplant in '92, and 10 years later her husband became a stem cell donor, and they allowed me to show this. That's members of my organization, and that's only two examples. So we always can explain in a very good way what happened and how it happened. But we also need additional treatment options, so psycho-oncology support to avoid psychological oncology complications. Then, because if you have the fear as a patient that you won't survive, that there will complications, then you are not really coping with treatment. And what I also think is very important, promoting the patient competence to strengthen the mental and emotional condition of cancer patients. And we need always surveys to improve the efficiency of tumor treatments while reducing unwanted side effects and improving quality of life. And I'm working in the European Hematology Association in a scientific working group, Quality of Life and Symptoms, and can bring in the voice of the patients as well. And I think that is important. And like I said, EBMT doesn't have this, but many of the companies already, when they are designing trials or so, they ask now patients, advocates to bring some input, what is needed for the patients or what is not really necessary. So we had a lot of success there. So, and this is, again, repeating, but patients want to have the best quality of life and well-being, and they need to have information on ongoing trials and other treatments, and also supporting possibilities like, social networkers that they can explain what is possible. And all these will improve the adherence or compliance. And what I already said, that they have to explain that palliative care doesn't mean hospice. So, and every hospital and doctor should explain that there is a group for patient self-helping possibilities, and that we are not always mourning and crying to each other, that we're really laughing and having fun, and therefore we call ourselves, my local group, communicating and information. So, and therefore we have a lot of men what normally don't look for a self-helping group. They all think, that's only women who are knitting and drinking coffee. That's not our turn. What cancer patients need are policies that put patients and their needs in the center of treatment and care. And I mean, everybody has a term, patient has to be in the center of everything, but often that's lip services and not really reality. And we need increased information and support services, multidisciplinary care from trained professionals, including the nurses. They are often forgotten. And reduction of the isolation that characterize the lives of people living with cancer and rare cancers, and equity to biomedical and clinical research. And here I have a quote from a patient. When a patient needs an innovative, promising cancer treatment, it's extremely frustrating and incredibly worrying to be told that there's no access or enough money to fund this treatment. Also, it's, on the other hand, so many obvious wasted in the health system, and I know that there's a lot what we could really save. Why patients' organizations are advocating? Every cancer patient deserves the best, no matter where he or she lives, social or aging issues, and there we also try to make a difference in the ongoing trials, because often they have excluded by age, that some trials only allowed patients to be in until the age of 65. So, and there are many, many other things. We need to make a big change in this, that really also the patients are not known by age, but by biological age, but like they are really. So access to the treatment and guideline basis, but we heard and we learned that not everybody is using this really, and evidence-based medicine rather than economic considerations, and working across all disciplines, multidisciplinary and multi-professional, including patient representatives like advocates. And this shows, who is all there. And in Germany, I have the problem that it's not really not wanted to see that we are also working with pharma or pharmacists, because they think we are too much influenced by them. But I think as much we can influence them, it's a good network, and I think we can also make a change in the health insurance. So this week just launched at the ECHO Congress in January in Amsterdam, and I want to encourage you to look after this, and we just started in Germany as well, and I'm part of this, and the former leader of the GBA, what is the authority organization in Germany, is now also with us. So he changed his meaning. So, adieu again.